Keycap 1 Introduction. Aspirin, chemically known as acetylsalicylic acid, ASA, is one of the most widely used medications worldwide. It belongs to the class of drugs called non-steroidal anti-inflammatory drugs, NSAIDs. It is used to relieve pain, reduce fever, decrease inflammation, and prevent blood clots. Keycap 2 Mechanism of Action. Aspirin works by irreversibly inhibiting cyclooxygenase, COX-1 and COX-2, enzymes. This reduces the production of prostaglandins, which are responsible for pain, fever, and inflammation. It also blocks thromboxane A2, which prevents platelet aggregation, blood clot formation. Backhand index pointing right. Because of this, low-dose aspirin is commonly used as an antiplatelet drug. Keycap 3 Indications, Uses. Heavy checkmark mild to moderate pain, headache, toothache, muscle pain. Heavy checkmark fever. Heavy checkmark inflammatory conditions, e.g., arthritis. Heavy checkmark prevention of heart attack and stroke. Heavy checkmark prevention of blood clots in high-risk patients. It is commonly prescribed in cardiovascular diseases to reduce the risk of myocardial infarction, heart attack, ischemic stroke, transient ischemic attacks, TIA. Keycap 4 Dosage. Small blue diamond pain/fever, 300 to 600 milligrams every 4 to 6 hours, adults. Small blue diamond antiplatelet effect, 75 to 150 milligrams daily, low dose. Small blue diamond maximum adult dose, usually 4 grams/day. Warning: dosage must be adjusted based on patient condition and age. Keycap 5 Side effects. Common: gastric irritation, nausea, heartburn, serious gastrointestinal bleeding, peptic ulcer, hypersensitivity reactions, tinnitus, ringing in ears, especially in overdose. Warning: aspirin should not be given to children with viral infections due to risk of Reye's syndrome. Keycap 6 Contraindications. Crossmark active peptic ulcer. Crossmark bleeding disorders, e.g., hemophilia. Crossmark severe liver or kidney disease. Crossmark aspirin allergy. Crossmark children with viral infections. Keycap 7 Drug interactions. Anticoagulants, e.g., warfarin, increased bleeding risk. Other NSAIDs increased gastric irritation. Corticosteroids higher ulcer risk. Methotrexate increased toxicity. Keycap 8 Pregnancy and lactation. Avoid in the 3rd trimester, risk of premature closure of ductus arteriosus. Use only if prescribed during pregnancy. Small amounts pass into breast milk. Keycap 9 Overdose, salicylism. Symptoms: nausea, vomiting, hyperventilation, tinnitus, metabolic acidosis. Treatment may require activated charcoal and supportive care. Keycap 10 Storage. Store at room temperature, away from moisture and heat. Pushpin summary. Aspirin is a versatile, cost-effective, and life-saving medication when used appropriately. It plays a major role in pain relief and cardiovascular protection. However, it must be used cautiously due to the risk of gastrointestinal bleeding and other complications.